Good afternoon. Today is Monday, April 20th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. With me today are Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department, and Kevin Pooley, Director of the Oswego County E911 Emergency Communications Department. To start with today, I'm happy to announce that the Governor has lifted some restrictions and has reopened private golf courses and marinas and state park and DEC boat launches for private use. Customers must still adhere to social distancing, and charter services are still closed because they are considered non-essential businesses by Empire State Development. But this is a positive step forward and allows people to get out on the water and enjoy our beautiful outdoors in this nice weather. We ask people to continue to follow these CDC and New York State Department of Health guidelines. Try to keep at least 6 feet of distance between you and others. Avoid close contacts such as shaking hands. Wash your hands often and use a hand sanitizer with soap and water are not available. Avoid surfaces that are touched often, such as rails, posts, and tie-off cleats. Wear masks in public when appropriate. Social distancing cannot be maintained. Remember that people can spread the virus without even knowing that they are infected. That's why it's so important that we continue to practice social distancing. And now I will turn to Diane Oldenburg for today's daily update on the status of COVID-19 cases in the county. Diane?
Thank you, Mr. Chairman. To date, we've had 1,244 residents either tested or scheduled to be tested for COVID-19. We've had 56 positive test results come back for COVID-19. We have 42 residents that have currently recovered from COVID-19. We have 1,127 negative test results that have come back. We have 55 test results still pending. And we've had 2 deaths reported due to COVID-19. Currently, 85 residents are on precautionary quarantine, and we have 88 residents on mandatory isolation or quarantine. With more and more of our residents tested and recovered from coronavirus, many people have wondered how first responders are handling calls for assistance. Our E911 director, Kevin Pooley, is here today to share information about how these changes have affected the E911 emergency operations. Kevin?
Thank you, Mr. Chairman. Thank you, Diane. I'd like to talk today about first responders, police, fire, and ambulance teams, as well as 911 dispatch. During this coronavirus outbreak, it's very important to do all we can to keep first responders safe and minimize their risk of exposure to the virus. As you just heard Diane Oldenburg say, there's dozens of people in isolation or quarantine throughout the county, often in their own homes. To comply with federal and state privacy laws like HIPAA and to protect patients' privacy and dignity, these locations are kept confidential by Oswego County and many other counties. So, what happens if police, fire, or ambulance teams get called to one of these positive or potentially positive addresses? To protect our first responders, Oswego County flags these addresses in our 911 computer-aided dispatch software. If an emergency call for help comes in from one of these addresses, our dispatchers notify first responders to wear their personal protective equipment. Not all counties are taking this extra step to protect first responders and prevent the spread, so we're proud of the fact that we are doing this in Oswego County. 911 will also ask a series of questions such as, are you or any member of your household under mandatory quarantine? And do you or anyone you have been in contact with have known symptoms of the coronavirus? Please be ready to answer these questions like these so that 911 can assist you as quickly as possible. Also, be patient as we ask our questions and do your best to answer all questions so that 911 can get you the assistance you need as quickly as possible. 911 telecommunicators are here to help you, so help them do their jobs by answering all of our questions. It's also important to keep 911 up and running, not only for coronavirus calls, but also for all the regular calls that we continue to receive. What would happen if a 911 telecommunicator gets sick? To plan for that, we have a screening process in place for our telecommunicators, and we've activated our 911 backup center to separate telecommunicators. The 911 primary and backup centers are both capable of dispatching for the entire county. This way, if one of the centers is compromised, the county can continue to dispatch first responders to help citizens in need. We are also working very closely with our neighboring counties to help each other should the need arise. We continue to work very hard to protect each and every person in Oswego County. Thank you for your time, your patience, and your support of the protective measures that are helping us come through this difficult period.
Thank you, Kevin. We appreciate the work that you and your team are doing to keep our community and our first responders safe. We're a strong community, and we will get through this together. Wash your hands frequently, wear a mask in public, and practice social distancing. You are doing your part to help reduce the spread of COVID-19 in our county. I want to encourage you to share these videos with your family and friends and refer to the Health Department's COVID-19 webpage for accurate and timely information about the situation in our county. If you have questions about coronavirus, you can call the County Health Department's COVID-19 hotline at 315-349-3330. This hotline service is staffed every day from 8:30 a.m. to 4 p.m. We will get through this together. Once again, I thank you for your continued patience and cooperation.